Meanwhile, Sydney's fast-growing coronavirus outbreak has become a national emergency, according to state leaders, as Australia's largest city reported another record number of new infections. Admitting a month-long lockdown had failed to stop a Delta variant outbreak, the state of New South Wales pleaded for Canberra to urgently send more vaccines and resources. Calling the outbreak a national emergency could pave the way for more federal government involvement in stemming the crisis. Berejiklian also announced that non-essential workers in specific areas of Sydney would now be barred from leaving, tightening a lockdown that is almost certain to be formally extended next week. With the virus spreading everywhere and half the country's 25 million people currently in lockdown, Berejiklian said the government must refocus its glacial vaccine rollout. Just 12% of Australians have been fully vaccinated due to problems with supplies of Pfizer jabs and skepticism about the safety of the AstraZeneca vaccine. Take a look.
The crisis cabinet meeting of the New South Wales government met this morning from 8 o'clock, where Dr. Chant and her team advised us that the situation that exists now in New South Wales, namely around southwestern and now western Sydney suburbs, is regarded as a national emergency.
I have advised the government today that this is a national emergency and requires additional measures to reduce the case numbers. What we are seeing is that the actions taken to date have averted many cases, but what we are not seeing is the turnaround that we would have liked to see at this stage. Indicated to the government that we need an intensive vaccination program using both Pfizer and AstraZeneca in that area, and I would recommend to anyone across New South Wales to make a booking for AstraZeneca and to get their dose of AstraZeneca regardless of where they live, whilst we are developing a very targeted and intensive strategy in that southwestern and western Sydney.
What is going on in New South Wales has the impact of affecting the rest of the nation. And for that reason, she wants us to up the ante in relation to a national refocus of the vaccination strategy, to refocus into those key local government areas, into those local communities. What we do need is a refocus of extra doses, and that's why we will continue to have those conversations. That is the bottom line. We need a refocus of additional doses to get as many people in that community with at least the first dose as possible, because even with the first dose, it reduces your chances of spreading it to as many people as we're seeing occur.